I've got a great question for you. Which skills do you believe make the biggest difference between a good medical writer and an excellent one? This is such a good question. So the first thing I would say is how easy it is to communicate with the medical writer themselves. So if you're a good medical writer, that means you can take instructions. If you're an excellent medical writer, that means you will critically think about the instructions that you're given and you'll ask questions about those instructions, because maybe the person who is giving you those instructions doesn't actually know what they want from you, and you're the expert when it comes to the medical writing, and you want to make sure that what you're going to write is actually going to perform well. So that means the audience that you're writing it for is going to understand what you're saying, and also the purpose of your medical writing is actually going to be fulfilled. So that means that you're going to be able to maybe sell a product or get a donation or get people to sign up for a newsletter, or maybe inform them or persuade them about a new way to do something because you've got new evidence which is meaningful to maybe change the way that they practice as a doctor or something like that. So the other thing that differentiates a good medical writer from an excellent one is someone who is going to do the work with enough research. And so a good medical writer might go away and do some research and just kind of get the work done, which is great. But an excellent medical writer will find the best research and they will get the work done. It might take them a bit longer. And so I think the excellent medical writer is going to make sure that they're not using too many references or sources, and they're going to stick to ones that are more official. And the other thing is that an excellent medical writer might go that step further and actually interview an expert in the field of the topic that they're writing about. So the third thing I would say as the main difference between a good medical writer and an excellent medical writer is making sure that the formatting of the document is easy to read. So a good medical writer will get all the information on there, but maybe they're not going to include headings or bullet points, and maybe their writing might be a little bit waffly. So that means they're including information that maybe they could cut out and just be a bit more concise. And so the excellent medical writer will be quite precise in their writing, and so they will need fewer words to actually communicate something meaningful. So great question, and I hope you found that answer helpful.